Hi, can you hear
Hello,
me
ma'am.
now?
How are you?
I'm good, thank you. Is everybody here? Let me know when to start.
Yes. Sure, ma'am. We'll just wait for a couple of minutes.
Sure.
Yeah. And how are you doing, ma'am? How is weather there?
Fortunately, it's almost springtime now, so as you can see, it's nice and bright outside. Uh,
Okay.
so we're kind of enjoying the sun.
All right. Here in Riyadh,
Sorry.
yeah. So here, just give me a second, ma'am.
Sure.
So start, ma'am. I'm so sorry. Again and again, I'm calling you, ma'am. I'm keep forgetting that. I'm so sorry.
No, that's okay. It's
Yeah.
yeah, it's something that I've got unused to now. I mean, it was the same with
Okay.
me. So yeah, I'm more than happy to be called by my name. No, ma'am.
Sure, I'll try. I'll try.
All right.
Yeah. All right. We'll start. Uh, So, hello everyone, welcome to today's Instagram live session. I think finally the wait is over. I'm excited to see many of you are joining in different parts of India as well as different parts of the world. So, thank you so much for taking the time and being part of today's discussion. I'm sure many of us wishes to move abroad. I understand that every one of us eager to explore job and education opportunities in abroad, especially in the UK. But since I don't have direct experience with the UK system, I wanted to bring who is some expert or who has good experience in the UK system. So that's how I thought of doing this live. So that time only Ms. Sumi Vagis instantly came to my mind. So thanks for joining, ma'am. I'm sorry.
Thank you, Kishore, for the opportunity. And I guess it's been a long time
Yes,
that I haven't had a chat with my fraternity. I guess it was back in 2021. After the lockdown, we had a first rest scare,
yes.
and that's when I was presenting a topic, and that was the last time I spoke to. So it's been a long time, and I guess uh, I keep getting messages on LinkedIn, on Facebook, on WhatsApp as well. Those who know me,
Hmm.
they would ask the same question, and I guess this is a great initiative. So this is on a larger platform. A big kudos to you, Kishore, for organizing this. It's not easy organizing an event, let it be any event, either on a small scale or a large scale. It's very difficult to coordinate any events. So thanks for calling me, and I thank you for making a part of this, making me feel that I'm still somewhere part of RT, which is something that I am proud of, because in my talk I will mention how flexible our course is. It
Hmm.
helps us mold into the different requirements that we have in NHS. Uh,
Thank you
so,
so much, ma'am. Yeah, please. I'm sorry.
is it okay to start now?
Yeah, we'll just wait for a minute and then we'll start. Meanwhile, let me just share you a small story how we met. I don't think you remember that.
I do vaguely remember you, because my best friend Sulochana, who's now the head of Bharati Hospital in Pune, so she did mention, we keep talking about
Okay.
respiratory therapy in India, and I guess It was in Bangalore conference that I met you for the
Yes,
first time.
absolutely.
I
We
vaguely
met
remember you.
only once
That's correct.
in 2018 in the
That's correct.
Bangalore
That's
conference. Yeah.
correct. But I guess it's a great achievement what you're doing now. It's not easy doing a PhD.
Thank you, ma'am.
Let
Thank you
alone
so
doing,
much.
doing a master's was not easy for me. I know how difficult the coursework is, but I don't know how you're doing it. But and kudos for almost completing it. And I hope, I don't hope, I'm sure that you will go or reach a height where you're meant to. And all the support from me and my colleagues, especially Sulochna really well,
Yes.
how supportive she is.
Yeah.
So yeah, let us know if you need any suggestions, any help. We are always here.
Sure, sure, definitely. And successfully, we have reconnected after so many years. So initially, I was a bit nervous about hosting this program, but after our conversation yesterday, all that changed. It was like, catching up with an old friend after so many years.
That's
So I'm very glad that you have joined from UK. So thank you so much, ma'am, despite your busy schedule and commitments. So you have joined to address these young artists in various parts of the world. Thanks a lot. Thank you so much.
thank
So
you.
let me introduce myself. Everyone, those who don't know, those who are not aware of me. My name is Kishore Kumar. I have completed my PhD recently and have moved to Saudi Arabia. Currently, I'm working as a faculty in Department of Respiratory Therapy. So this is all about me. So now, and one more interesting moment is, um, so we are joining three time zones today. One is India, and the other one is UK as well as Saudi Arabia. Saudi Arabia is, I think, 2.5 hours behind India, and I'm not sure about UK. I think 7 or 6 hours, I guess.
Yes, because from India it is 5.5 hours. So if you're still further,
Yeah.
it will be 1.5.
Yeah. And today's program will stick with time. We'll wind up this session at 8 p.m. Indian time, which is 1 hour long. So make sure everyone, please stay connected. Don't miss the program. Don't leave the program. So now, without further delay, let me introduce Ms. Sumi Varghese, who is a respiratory therapist and has become respiratory physiologist now. Ma'am, now the platform is to you. Would you please share how it has happened from respiratory therapy to respiratory physiologist? How
Sure.
does it happen?
So thank you, Kishore, once again. So those who don't know me, my name is Sumi Varghese. I did my bachelor's in respiratory therapy, BSc, which is BSc Medical Technology in Symbiosis, specializing in respiratory therapy. And from there, I moved on to do my master's in respiratory therapy from Manipal Academy, Manipal University, specializing in adult respiratory care. And and from there, after that, I joined Mangalore campus, which is the same college under Manipal University as an assistant professor. Worked there for nearly a year and a half, and then I decided, well, obviously, like you said, we all at some point want to um, leave our home country and try something different, move abroad.
Yeah.
I mean, that made me take up a course in New Zealand. So
Okay.
between I had a pit stop at New Zealand. I did a course which is more related to public health. And when I went there as a student, I understood what are the struggles of an international student, and also how to overcome these struggles. And also, they do also have respiratory physiology there. So, UK, Australia, New Zealand, all these countries, they have respiratory physiology and not respiratory therapy. So
Okay.
I appeared for the exam there, which is called as CSRT. If I am not wrong, it is called as Certificate for something pulmonary function testing, something like that. So there was an exam, and during I mean, while I was studying there, I did part-time course, obviously to support ourselves. That's one more thing I would like to, touch while we are talking. So apart from the huge fees that we pay for the course, obviously you
Yeah.
have to support your daily living, which is your cost of living,
Mm-hmm.
and we have to support ourselves by doing jobs. So I was working as a support worker, and then by the time when I finished my job, and all this happened during lockdown. So
Okay.
and then I thought things would get better, and I was newly married back then, and then I thought, okay, let me just try somewhere else, and that's when I thought, let's try a job in UK. So this is where we started. So when I applied for jobs in UK, what I did was, back then it was NHS jobs, and now it is NHS track jobs. So
Okay.
there's a website, and this is where I applied my job,
Mm-hmm.
and then I um, went on to I started connecting with the manager there. So this is one option we have.
Okay.
We can informally contact. There's a contact person in every job description. So let you can try and contact with them, and if they're helpful, they will try and help you whether what they do as a department, what are the job roles. Obviously, the job roles will be mentioned in job description as well. And then that's how I ended up here.
All right.
So
That's
I know,
great, ma'am. That's great. Yeah.
sorry.
Please, ma'am. Please continue.
So we have somebody asking me to start answering the questions. Unfortunately, Dareen, I don't have the questions right now,
Darin,
and we are trying to.
yeah, I have the question. Let me just read it out.
So what I'll do is, I'll just pinpoint some points. How different is RT and physiology, or what do you think is the plan? What do you want me to do? Is just answer questions and then
Yeah.
do.
Let me just read out because yesterday we received
Yes.
questions, and I hope today also some audience might ask questions. So better we'll address yesterday's question first,
Mhm.
and then we'll go to today's question.
Okay.
All right. So yesterday I received maybe 15 to 20 questions, I think. The first question, what are the pathways to get into NHS from India? Do we need IELTS?
Um, when you speak of pathways, it is just directly, like I said, like what I did. You
Mhm.
apply on the job site, which is called Track Jobs, TRAC, Jobs, NHS Jobs, and there will be, and you go for a section which is called Healthcare Science, and this is the category we fall under here. That is, we are all healthcare scientists, and then you enter keywords like physiology or respiratory physiology, and there will be jobs throughout the UK, and then you apply. Speaking of IELTS, yes, you need it because of multiple reasons. Number one, you would need it for your visa process. So obviously, we are not native English speakers, and uh, if we come from a non-native English speaking country, you need to prove that you're proficient in the language, because as healthcare professionals, we talk to patients more,
Mm.
and especially in my job role, we do sleep physiology, where we treat patients with obstructive sleep apnea. And what we do is we diagnose them, we treat them, we follow them up. Throughout this whole process, you would do a face-to-face contact with patients and also over the
Mm.
phone. And then you do letters. Now, these are medical notes. These are not just handover notes, but actual medical notes,
Okay.
which will be copied to the patient and to the GP. And obviously you need your language there. So
Mm.
I know people try to take shortcuts. Why do I need IELTS? There is an alternative which is called NARIC, NARIC.
Mhm.
So basically, for visa purpose, you can submit your degree to them, and they will see on what proficiency level you are, and then for visa process you can do. But I would still recommend doing an IELTS just for
Okay.
this sole purpose, because this is what you will be doing. You will talk to people more. You need to understand what they're speaking, and
Okay.
it's not just English. It's just the dialects that they speak in. So when you do IELTS, you will be trained to how to listen to them properly and how to understand this. So this training will help you in your long run.
Thank you. And next question, how different the job role in the UK versus India?
So, as respiratory therapists, we work in different sections.
Hmm.
So we work in respiratory medicine or pulmonary medicine. We have a in-depth understanding of mechanical ventilation.
Yeah.
We some of our artists work under sleep physiology. I mean sleep sectors. They do polysomnography and all.
Hmm.
So all these, so whatever we are learning in our course or when we are doing a job as an RT, these are skills that we are gaining. Okay.
Okay.
Now in the UK, as a respiratory physiologist, what you do is the again each trust has different job roles. Majority it will be more of doing lung function. Now this is
Hmm.
something that we are not keen on doing back in India, and we think, oh, these are technicians, but this is quite a high skill job here. So we do both basic and advanced lung function tests, and then there is another section of sleep physiology where we do respiratory polygraphy just to
Okay.
diagnose sleep apnea, and then if they have a severe, based on the severity, we decide whether they need CPAP or they need BiPAP, and then that's how we take on. And so I would be soon starting new role, which is home mechanical ventilation. So we had a discussion yesterday.
Yeah.
So there is a so we mostly deal with in critical care patients. Now
Hmm.
I don't know, we have much experience with people who get discharged from the ICUs in the wards and into the community. So people who need long-term mechanical
Hmm.
ventilation, there are team who manages this. So obviously you follow these patients up, and you would need to do a blood gas on site,
Okay.
off site. You will have a point of care testing machine just to check
Hmm.
if the ventilation is good enough or not. So, and some centers also do oxygen.
Okay. Hmm.
Yeah, this is something what we do here. So with oxygen, it is
Okay.
more related to long-term oxygen therapy or
Hmm.
ambulatory oxygen. So this
All.
we to assess them whether they need oxygen or not. So this is the difference. Now, as a respiratory therapist, we know all these skills. So that's why I tell you we have these skills, and it is quite easy to get jobs into respiratory physiology because we have these skills. Unfortunately, in the last few months, things are now changing a bit. The immigration laws are getting a bit tighter now, and giving sponsorship for international applicants is now getting a bit more stricter. But I think in healthcare, they would still need more people. It totally depends on that trust and that manager whether they want to hire you, they want to give you a sponsorship or not.
Okay. So I think it's hard process.
It is. The
Yeah.
process,
And
I
many
don't
of the
think it
students,
is
yeah,
hard. Go on.
many of the students they keep asking me after completing their graduate degree program, either bachelor's and master's, how can they apply for the jobs? Whether do they need any experience for that, or as a fresher they can simply apply?
No, I do recommend, and I have recommended in the past to have at least 1 year of experience because obviously we come from a different background. Although I say we have similar sets, but we come from a slightly different background. And if you can show in your CV that you have these skill sets with you to practice as respiratory physiology, it will be easier. Obviously, they would not want to hire somebody
Hmm.
who is not trained, and they would not want to hire somebody spending so much money and bring here and then giving them training. So I would suggest at least 1 year of training in
Okay.
at least breathing, pulmonary function tests, polysomnography or polygraphy, all this area, and then apply for these jobs. It is easier. And recently, I guess, A student of mine from Mangalore did get a job as well as a senior respiratory physiologist as well. So obviously she had the right skill set. It is also important what you write in your CV. So don't just
Okay.
randomly dump everything what you do as an RT. So when you look at the job, there is something called as job description. There will
Mm.
be a PDF attached to that job. So they will say what are they expecting from that particular candidate. Go through it and read it very well. Check whether is it something that you want to do. Is it something you are interested to do? And is there any job progression? Okay, if you have any doubts, please email that particular person, and then contact that person, get your doubts cleared, or contact anybody like us here,
Mm.
and try to get your doubts solved and then apply. Don't just randomly apply for jobs and just dump everything in your CV. There will be a high chance that you will get rejected because they don't know what to look at, because there's so much to read in your CV.
Okay.
So
Which will be
filter.
the best option? Like having 2 years of experience and trying for the job, or doing masters in the UK and then trying for the job? Which will be better?
I am not a high fan because I myself have experienced that, because normally we take a master's course and this is
Mm.
the trend, and this is where most of the agencies, they try to, cheat us, I would say. Not cheat us, but
Okay.
they try to make things look better. Because
Mm.
with a master's degree, what you have to think whether, I've written something down here. Yeah, you have to check whether that course is relevant. I have seen a lot of respiratory therapy students coming here, and that to a particular university. I don't want to name that university,
Mm.
but they come for that course, which is Masters in Respiratory Medicine. But can you understand? It is not respiratory therapy, it is
Yeah,
medicine.
that's what my question, my next question is. In UK, there are, the terminology is different. Like respiratory medicine is there, MSc cardiovascular technology,
Yes.
MSc perfusion technology, cardiopulmonary technology. Like
So
so many terminologies are there.
you
So which
have
one
to
is,
you
yeah.
have to go through the course, and if you don't know what's happening in it, try to contact somebody in the UK and ask them, is this relevant? But even after, I've advised them, they just go, because they just want to get an entry into the country and then apply for a job. Obviously they're thinking rationally, while I'm in the country, my chance of getting hired will be higher.
Mm.
But just to get into this country, you are spending 10 to 15 lakhs. Okay, that's a huge amount, which I'm not obviously we have to take loans and everything. So you have to think ahead why you have to do, whether you can do it or not, and whether the course you're doing is relevant. What's the point of doing a course? And I have to tell this anecdote. I had one doctor here in my university. She is from Bangladesh, and
Mm.
she was talking to me about her course she's doing. It's the same course, MSc Respiratory Medicine. So she's a doctor. She's now specializing in respiratory medicine. That's why she's doing a course. And when I went through, I did ask a junior of mine to just go through with the syllabus of it. It's more research related. It is
Mm.
more assessment and everything, which we know already. But as a physiologist, we will not do an in-depth assessment of these patients here, like what we've been taught back in India as respiratory therapists. So this is something we have to see, and obviously you don't want to spend that much amount if you're doing an online course sitting in the UK.
Yes.
Okay, so um, check whether the course has any registration
Mm.
opportunities. Check whether it will lead you to a registration. If it does not, then I don't think it is a point. You can also get a job directly if you have the right experience. If you put the right CV in the job, right job specification, then you will definitely get a job, and it is much easier and less and economical as well.
Okay.
That's what my suggestion would be.
And do you have any idea that these courses are globally recognized? Like I hope it is 1 year course.
So I don't think they're globally recognized. So obviously, I also went ahead and did a similar course back in New Zealand.
Mm.
So what the rationale here is, so I'll tell you the rationale here. So these people, so nurses and other allied health professionals who have a BSc degree, they are practicing in this area for a long period. Then they think, oh, I have to specialize in this particular area. and then they take up these modules. So these courses can be divided into modules, like research is one module, patient assessment is one module, and some people do it in modules, okay, some people do it in one full stretch, okay. And then they're trying to specialize in it just for the sake of going ahead or developing. So if you are at a starting phase, how can you specialize in an area, and or how can you get into a course where it is not meant for you? This is something that you have to think. Yes, it is recognized in the UK, but not, I don't think it is anywhere else.
All right. Okay, and next question would be, how difficult for you to make the people from UK to understand who an art is? But really, do they care of respiratory therapists? Do they know?
No, they don't know what, because like I said, what my understanding is, and this is a fact, respiratory therapy is a US based concept which we are
Mhm.
following in India. And obviously, respiratory therapy, we all know, came to India when doctors, if I'm not wrong, um, a founder is from Manipal, I mean, and also CMC Vellore. They went to US, they studied the course, then they brought this course in India. It
Yeah.
is more of a US concept. And here we are healthcare scientists. And
Mhm.
when I speak, my manager was already aware of my background. So that's the reason that she got me into the team, because she knew I had some skill set. And then when I spoke to the other team who is doing more of mechanical ventilation or long-term mechanical ventilation, I told them this is what I used to do. They liked me, but obviously I cannot just jump into it. So I was waiting for the right time. They had a job opportunity, then I jumped into it. So this is something, and they're very much happy with the skill set that we have. It's just finding the right opportunity to get into a particular team or particular job.
All right. So I have my personal doubt. Are respiratory physiologist and respiratory physiotherapist are same, or is it different?
No, they are both. They are both. Oh, I'm sorry. I just got
No,
a
no.
comment saying that they can't hear me. Am I audible or am I muffled? My voice is muffled.
For me, your voice is very clear.
Okay.
Guys, please let us know in the comments whether the voice is clear or not.
Okay. So, so respiratory physiotherapists are physiotherapists registered as physiotherapists practicing in respiratory area. Okay, these are the physiotherapists working in respiratory wards, specializing in respiratory, cardiopulmonary rehabilitation, and everything. And respiratory physiology is totally different. This is something what I am doing here.
Okay.
Is this is more of an outpatient level care, and they are
Mm,
doing of inpatient care. They also do outpatients as well,
okay.
but we are predominantly doing more of outpatients, more into diagnostics and also treatment of in sleep. We are doing more of treatment and management.
All right. And to enter, I mean, to work in the UK, do we need any particular license like RRT or something like that? Are there any in the UK?
No, again, RRT is a concept, more of a US based concept, not here. So outside India, so majority of these courses, if you are in healthcare, obviously you're dealing with patients, you're dealing with live people, and you need a registration, because unless you have a registration, you cannot do any intervention. And this registration is what they call, back in the US, it is called RRT, registered respiratory therapist. And here, as a respiratory physiologist, the registration is quite because if you have a degree in clinical physiology from the UK, your registration is straightforward. Okay, so you are part of the AHCS, it is called as Academic for Healthcare Science. So that is the registration body for the physiologist here. It used to be RCCP, Registration Council for Clinical Physiologists, but now it is Academy for Healthcare Science. Now, since I don't have a qualification in respiratory physiology, I have to undergo a process where I'm submitting my documents and everything, and they will do an equivalence procedure for me. And then, I mean, it is not mandatory for me to get a registration, but obviously I have to go undergo training first, so that they make sure that understand what the UK practices and everything. And there is a specific body for respiratory physiology itself, which is called as ARTP. It is called as Association for Respiratory Technology and Physiologists. So, but they are not a regulatory body. It is just you be a member of it, you get updates about what happens in respiratory physiology, you participate in the CMEs that they do, but they don't do any registration. We have to do registration through AHCS.
Yeah, thank you. And one more question from yesterday's comment. They have written to become a respiratory physiologist. Is it okay to study any degree related to healthcare or respiratory?
Sorry, can you tell that again?
To become a respiratory physiologist,
Mm-hmm.
is it okay to study any degree?
Again, it totally depends on you. If you want to spend that amount, again, this is something what I've just touched just few minutes ago. If you want to spend that amount, do a random degree, get into the country. Yes, there is a high chance of, be maybe being selected because you are in the country. They know you are here, and it is easy for them to recruit you. But again, do you want to spend that money? It is totally upon you.
All right. And do you have any idea about PhDs in the UK? If someone wishes to pursue their PhD?
Again, this is something an individual who, as a respiratory physiologist who wants to, think ahead and they want to do more in research. So there is something called as, if I'm not wrong, HSTP. Sorry, I know there is a degree called as STP, Scientist Training Program, and there is something called as HSSTP, which is Highly Specialized Scientist Training Program. Okay, so this is a program run by the NHS England. So if you, so obviously, trust like a particular trust who wants to have such person, they will put out jobs for them. So they will hire this person as a physiologist. They are working as a physiologist, and while they are working, they are under a contract for 3 or I don't 3 years for STP, but for PhD I don't know how long it is. So you're working at the same time you're getting that degree, but again there's no direct PhD level. Or if you already have a PhD, like you will get one soon, you can apply for a equivalence program. Okay, so HCPC is a better body that you can register with. So what you do is you contact them, you go through an international application process, you submit all your registration, sorry, all your degree. You give in detail during all this degree what you have done, what are the coursework that you have done, how many hours you have spent. They will assess it for you, and then they will say, okay, this course is equivalent to PhD. Yes, you have it. And then they will grant you a PhD, and then you have a registration now. Based on this registration, you can apply for a job.
One more question I received yesterday. Does universities ranking really matter to get a job in the UK as a respiratory physiologist?
No, I don't think so. As long as it is a valid university, there's a physical building, and obviously there are a lot of spams going on. But I know, if it's a recognized, they will they don't see much into whether it is UGC recognized, but what rank it is. No, you have a degree from a valid university. That's all they want to know, and they want to know whether it's a legal paper, not a
Hmm.
forged paper. They go through all this process, and that's it. That's all they need.
Again, to pursue masters in the UK, IELTS is mandatory, right?
So IELTS is again two types, where there is academic and what's the other one? Standard, if I'm not wrong. So people who work, who want to get their registrations done or who want to do a course, they need to do an academic IELTS. So yeah, somebody just asked me, after BSc RT joining respiratory medicine in UK, is it worth and is it recognized by other country? Unfortunately I'm not sure whether it is recognized some in other country. But why would you want to again spend that money and then move from the UK? So you have to think before you get into this decision.
And the work related to respiratory physiologist would be pulmonary diagnostics only, or is it has some wide range of specialties?
There, I mean, it totally depends what trust you are in. So,
Hmm.
so in the UK, it is more respiratory physiology do more, and they are more involved in patient care somewhere in the North and Midlands. So they are more apart from diagnostics. So there is only few people who would do diagnostics, or there is only a certain band of people that would do diagnostics. And as they go higher, they specialize into sleep. They specialize into home mechanical ventilation. They specialize into long-term oxygen therapy. And so these are the areas that you can use. They also specialize in public health. They also specialize in different areas. So these are the areas choose or I mean it also depends which university you're applying. So whenever you're applying for a job in a particular hospital, so when I'm saying university hospital, it is an NHS trust. So
Hmm.
just check what is the review of this particular NHS trust. Okay, just check what is the turnover. If they have a lot of people leaving the job, why they're leaving the job, is there a particular reason, and then apply for this job. So again, just like your masters, do a background research of your job that you want to apply or the hospital that you want to apply. It is very important because if you're not happy there, obviously you would feel bad, right? So you will like, I left my home country just for this. You think all this. So, and obviously, we have cultural societies throughout the country. So we have Malayali cultural societies, we have Tamilian cultural society, we have Southeast Asian society. So just search them online or on Facebook. Try to contact one of them, get hold of anybody, and just check with them, have a chat with them, and get their review. And ask them, I'm planning to apply for this job here. What
Hmm.
is your review on this particular hospital? Is it good? Is it worth me coming there? So all this, and standard of living, I mean, sorry, cost of living, you have to consider as well.
All right. And we have also got few more questions, guys. If you have any question, please put it in the comment section.
I'm
Uh,
just trying to read some. So some this is something I would like to touch is which band should we apply as an experienced RT for respiratory physiologist? I would say nothing less than band five. I mean,
hmm.
band five at least you should try. So band four and below, these are more of trainee physiologist. So I guess, I mean, obviously if you are again, if you badly want to get try that job, try. But again, like I said, we have a huge skill set, and if you can prove that you can do these tests individually or as the uh, and you can do this on your own, then definitely band 5 and above.
And do they also has any academic jobs? Maybe like
um
lecturer, assistant professor, something like that.
I don't think they do a direct vacancy. Like I was doing, so my university hospital is attached to, or they are in tie-up with a university called University of Plymouth,
Hmm.
and they run a course called as BSc in Clinical Physiology, and they wanted from our department to do a course on some part of respiratory physiology, like basic spirometry and everything, because they might do it because some trusts have cardiorespiratory physiology, so they do both cardiac and respiratory. So so I'm not sure again. For that you need to know the universities, so you have to go through the university postings, check for any lecturer post. But again, it is very difficult to get a sponsorship from a university rather than
Hmm.
through NHS, so you have to think all this. um
Elizabeth has asked a question. Is it necessary to have experience in sleep or just PFT alone to work as respiratory physiologist? For example, someone has clinical experience in the critical care. Do they able to work as a respiratory physiologist?
I mean, it's the same. It was the same case with me. I was more into critical
Hmm.
care. I did some lung function, obviously bedside spirometry, just to do some basic assessments, and polysomnography was a part of my course. I did some setups or something during my internship, but these are the some what we say. I highlighted this in my CV, and I told this in my interview as well. So they know that I'm aware what I'm doing, but all they might they would decide, oh, she might just need some support in the start and then she's all right. So you don't need a proper training or a proper experience. So at the end of the day, it totally comes down to a manager whether they want to hire somebody who have some experience in respiratory and sleep, or somebody who's working for 2 years or more. Like my junior who got into recently into one of the universities. So she has more than 2 years of experience in pulmonary medicine in Chennai. So she does both. She used to do both lung function and sleep as well. So they would want such person more in their team, right? So again, it totally comes down to that particular manager or that particular trust who they want to hire. But I would say, try to get as much experience as you can. If you have plans to do a, a job as a respiratory physiologist, if you have or even if you do some, if you have some experience in bedside spirometry or pulmonary function testing or polysomnography, highlight this in your CV so that it is picked up by them.
And we got one good question. As a single person, it is manageable, is manage able to work with single job as okay. So in a family, only one person is going for the job. So do they manage their family?
It will be very difficult. So this is again, I guess I had one of my points here. So again, when you come, when you plan to relocate to any country, you need to have a chat with your family, especially with your partners, with your spouse, with your husband or wife, because they will be joining you at some point. Okay, so speak with them and check whether do they have any scope of getting jobs here. And one good thing about the UK is the market is quite competitive, and there is a high chance if you have the right experience you will get a better job here. But again, if not, are they ready to do different jobs? Okay, so there is quite a lot opportunities for jobs here, but are they ready to but it is not financially easy for only one person to work, because I should tell you, from your salary 20% at least is deducted, okay, as a tax. And then you have to pay national insurance, then you have to pay pension. So there's a huge amount deducted from your salary. And then apart from that, you have your cost of living, which is your rent, your water bill, your electricity bill, your council bill. So imagine, so you might, one person bill might only be sufficient for all this bill. So what will you do to sustain? Like you'll have daily groceries or weekly groceries. If you have a child, there will be other expenses. So think ahead, and if only if both of them are ready to work here, then take the decision. If the other person is not comfortable doing random jobs, it is very difficult.
So guys, those who are planning to move to the UK, please get married and come to the UK.
I'm not telling that. No, no. It is. I'm not telling that. But if you're coming with your partners, have a good discussion with them. How? What are the scopes for their jobs? Is it easier? Speak with somebody who is already in the UK, who has similar jobs in the UK, and check with them. If not, are they ready to do something else? When I see of something else, I mean, we don't have to belittle the jobs that we do here. Okay, you do not have to look down upon a particular job. At the end of the, it's a job, you're being paid for that. Okay, and every job that we do here has a dignity, and this is something I learned when I moved out of my country, because in our country we have this hierarchy system, but
Yeah,
here everybody is an individual who's paying taxes. Those who are paying taxes, they have their own right. I mean, they are looked up with dignity. Okay, so this is what you have to understand, that there's nothing wrong in doing random jobs.
great. And Pranit is curious to know about compensation, work culture, house, and work-life balance in the UK.
So one thing I would like to mention is the work-life balance. I was speaking with Kishore yesterday as well. So we have a good work-life balance here. So once I step out of my hospital, nobody would call me to disturb me, asking a doubt about patient, asking a doubt about something I did. They will wait for the next day for me to come to the hospital and then discuss. So they don't discuss work outside. Okay, so and if I'm on leave, I am on leave. They will not disturb me on my leave. And obviously you have set amount of leaves and you can decide how to use this leave. And UK is a very good spot to travel. Those who love travel, there are many places within the UK to travel, and we live in a lovely place called we are near Cornwall, which is a more of an what do we say, coastal area, and it's very beautiful in summer. And the pay is good, but at the same time, when you look at the gross pay, it is good. But I mentioned about all the deductions that we are speaking, so you have to consider all this. And if you have the right experience, you'll get good what do we say, jobs. And there is no hierarchy here again, so there's no junior senior. You don't have to be right in front of them. If you have anything to speak, you can speak boldly in front of them. If you are right, they will definitely listen to you. And if they have anything to say to you, they will make sure that it is happening personally, not publicly in front of everybody. And which is something very good, which we will appreciate. And it is quite multicultural here, so we have lots of Indians here and from people from different countries. So obviously it becomes a bit more easier when you have people from different countries here, so that you can see people from your own country coming, and you'll like be happy to speak to them. NHS itself, it is a good place. I mean, as a mother, when I was on maternity leave, I mean, sorry, after, I mean, during my pregnancy, my manager would check on me whether I'm all right or not. I don't think it is happening back in India. So it's just you do your work, you do whatever you do, but they do regular checks whether I'm feeling mentally. So mental health is a very important factor here. Okay, so
Okay.
I mean, there is you would get 1 year of maternity leave if you're eligible for that. If not, at least you know, 6 to 8 months you can get there. And also fathers, they have paternity leave for 2 weeks if they're on a full-time job. So they try to give a family a better what do we say, importance. They give family a good importance. So I kind of like it here. But at the same time, there will be climate. This is something that we all struggle. Okay, so there is complete 6 months of darkness. When I say darkness, so as soon as autumn starts, you know, it is more of a gray climate outside, cloudy, mostly rainy, very cold. And then, like at the start, I did mention that we are quite happy seeing the sun.
Yeah.
So now I understood why people would come to Goa just for sunbath. This is why
But
they love.
how often you go to India and do you get any summer vacations like that?
Obviously, I can decide how I will use my leave, but it is a
Mm.
cost. I mean, if I am going to India every year, so roughly for three of us, we are spending almost £2,000. This just for me, my husband, and my 2-year-old son. So
Mm.
it will be, he would be charged more now. So if I have more than one kid, that's another,
Okay.
rates. It's just working out that balance. Is it financially feasible for me to go every year? And obviously, we can bring our parents here on visiting visa, but it's only for 6 months. So this is something that uh, you could do. Yeah.
Yeah. And we got a question from Darren, I think. Do someone need experience for the masters? I don't think no. You can, after completing your bachelor's, you can directly join. And in the UK, do they have any private hospitals? What about that?
Um, I was also looking for one of my juniors from Manipal, Jovina. There are private firms apart from NHS, but
Mm.
again, at private, they would need some experience. Okay, so they also do locum work. So the term locum means you're doing privately. So and they will, so let's say my hospital has a shortage of physiologists, okay, or my the hospital has a long waiting list. They will hire a company who will provide the trust new physiologists or doctors to help with the waiting list. Now when I come as an agency, I'm a locum worker. Okay.
Mm.
Now obviously, if I have to work on my own, there won't be anybody else. I'm just doing my part. Okay, so I need some experience. So doing locum work or doing private work, they will still need some of NHS experience. So it is not easy to get a private job straight away.
All
But
right.
you can always try and apply. But getting private jobs is again through these private agencies who do. There are locum consultants on LinkedIn, so you can try and check with them, give them your CV, ask with them, is it possible? But you have to be in the country for locum works or private jobs. So
Some,
one more thing.
yeah,
So
please.
Jovita, this is for you. So she's asking me. So she want to start working as a locum,
Mm.
and they need an NHS experience. So there's, I don't think there's any other chance to compensate for this. Try and tell them this is the experience you have, because the reason why they ask NHS experience is because you need to know the system they are using. So NHS has their own systems. So and obviously if you're put in a different trust, the systems will be same, so you need to know that. So I don't think there's any other option there. Okay.
Someone has asked, in track website vacancies for respiratory physiologists is so rare. Are there any other sources where we can apply for job?
I don't think so, because I keep looking for jobs just out of curiosity, and if I find something interesting, I forward it to people who have asked me if I have opportunities. There is quite a lot of jobs. I don't know what is the keyword you're using. So
Mm.
just type respiratory or just type physiology, and you will get lots of jobs on track jobs. It also depends. So there is some time of the season, especially during Christmas time, they don't recruit any. So everybody's on leave. They don't recruit anything from 20th of December until mid of Jan. There won't be any recruitment. But I mean, even recently, I just checked for jobs on track jobs. Just make sure you are clicking on the healthcare science section, and then search for jobs, and then you will see. So there will be jobs throughout the country. Just check if you're having the filters correctly. So just try to put filters all UK and not one specific part of the UK. So when you press all UK, you'll get job opportunities throughout the country. So there should be jobs, I'm pretty much sure.
Can you please tell about respiratory physiologist in New Zealand?
Oh, oh. It is also a similar job. Unfortunately, I didn't work as a physiologist there, and by
Mm.
that I relocated here. But they do need the CSRT exam,
Mm.
and so you basically have to first take a membership with Australia, New Zealand Respiratory Science Society, something like this, and then this is the body that do this exam. So you speak to them, you get your exam registered, you have to sit in one of the centers. Okay, so if you are in New Zealand, you have to do this exam, and once you clear this exam, then based on this, so that is the registration for you, CSRT. Okay, and
Mm.
then when you apply for jobs in New Zealand as a respiratory physiology, if you have a CSRT, you can get a job. But I spoke to some of my colleagues in Australia. They said it is not mandatory for CRCT. So Australia and New Zealand have the same body. So they say it is not mandatory for them to have a CSRT. So check with the hospital where you're applying for.
Okay.
Um, so there's somebody by the name Hey underscore Aki. So he said that I got an interview offline from NHS for the post associate respiratory physiologist, but was not able to attend. So, please check your interview letter. What are they asking you to? I mean, are they asking you to come for a face-to-face session, or if not, check with them if they have, you know, Teams or Zoom call available so that they can do an online interview. Make sure you read your letter very well. Okay, so if there is no provision of online interview, check with them whether if they have any such provision for online interview. Yeah, or you can email them back and just check whether they can do it or not.
And Vinod has asked us, Soman, could you please tell me which master's course to choose?
Unfortunately, in India we have MSc in respiratory therapy. We don't have masters in respiratory physiology in the UK. So there's no master program. But if you're working in the NHS, or if you're working as a respiratory physiologist, you can apply for a scientist training program, which is equivalent to a master's level degree. So and then Some hospitals or some departments will run this program. Apply for that, and then you will start working as a band 6 for 3 years. They will train you for a band 7 position, and then then if there's a vacancy, you'll start working as a band 7. So, and if you have some managerial experience, don't hesitate to apply for band 6 and 7 jobs. Okay, so band 6 and 7 is more of managerial experience, and you're managing people around. So if you have quite a lot of experience with supervision and everything, please go ahead and apply for band 6. But if you just have clinical experience, I would say band 5. Okay, but try for band 6. If you have more than 2 years, if you have relevant experience for a long period, they will definitely will be happy to have you as a band 6 post.
Are there any good universities or standard universities in the UK? Like someone is trying to pursue their masters, would you suggest them any of the universities?
Um, um, with the I'm not much familiar with the ranking system here, but
Mm.
obviously there is times, right, if I'm not wrong, there is some ranking system like a TEF or REF ranking, something like that. So there is teaching based ranking and research based ranking. So just check for these rankings, and obviously don't go blindly what your agency person says. So they don't know what respiratory therapy is. So they will hear the word respiratory. They will see, oh, there's a respiratory course there, but don't know what is happening in there. Obviously, they are being paid by this university to get people, because universities get a lot of money from international recruitment. So international students pay almost 2 to 3 times the actual home local people. So obviously it is income for them. So that's the reason why the recruitment agencies don't charge you, because they're already
Mm.
getting paid by the university. So be careful, or be think a lot before you get into this loop of MSc, because check whether you want this course, whether it is relevant, whether it is something that will lead you to something. So just check all these factors.
Okay.
Um,
I
there is
hope
Jemima.
you're addressing questions. Can you explain in detail about AHCS registration?
So AHCS is the regulatory body for healthcare scientists in the UK. So recently, the respiratory physiology body, that is RCCP, not recently, 2 years ago, they merged with AHCS. So the main aim is to have one body for all the healthcare scientists. So before, we did have an international route. So those who had international qualifications, they could apply for their jobs here, come here, and then after some time they can apply for the registration. But that's how I came in. But by the time I was applying for my registration, this merging happened. Unfortunately, the new body do not have any what do we say, international application or registration process protocol. Not at the moment. They said they might have. So the what you can do, so if you don't have a registration, it will not stop you from getting a job. Don't misunderstand me. You can always apply for your job even if you don't have a registration. Okay, it's just coming here, and then again you have to speak with the manager if they're okay. So they will recruit you here. They will make you do some extra courses. Okay, they will first of all make you a member of ARTP and do some course under ARTP, and based on this you can apply for a registration. So with your international degree, you can go through an equivalence route. So again, the equivalence route means you are submitting your qualification. They will check whether it is equivalent to the respiratory physiology course here. If it is accepted, then you're registered under them. So yes. So even if you don't have registration, you can still apply for jobs.
All right. And I think we have come to an end. Maybe we can take 3 or 4 questions now.
Hmm, which master's course? So there is no
Jemima,
entrance. There is no entrance exam to be cleared for jobs. So you just apply for the jobs, and then there are no extra qualifications you need after BSc. So you need the relevant experience. Even if it's MSc or BSc, you should have relevant experience.
So, critical care roles for artists in UK. So, usually respiratory physiotherapists work in the critical care, right?
Yes, they do. But we cannot do that job because
Mm.
critical care is solely managed by nurses, doctors, physiotherapists who are trained in this. So there's no, I don't see a way we can get. Obviously, you need a registration to do that job now. So you cannot be registered as a nurse. You cannot be registered as a physiotherapist.
Mm.
Okay. So, but when I was looking for STP programs like the scientist training programs, and recently I saw a job post for clinical critical care scientist. Okay, so again, the job role is was quite similar to what we were doing. Okay, managing patients on ventilators, but at the same time it was also managing other equipments as well, like dialysis machines and everything. So I don't know if it's something, but I have not read much into it.
Mm.
So when you're applying for STP pro, but again, to do an STP, you have to be in the UK again. So if you're applying for STP, just if you're more keen in critical care, apply for the critical care STP, and then you can just see and let me know how it is, because I don't have anybody in my loop who is a critical care scientist.
Yeah.
There's one good question by Jovena. What are important things to focus while writing supporting information? Supporting statement is a core part of your CV and your job application. Okay, so you have to link the job description to your experience. Okay, so you have to see what experience is relevant from your experience, and link it to the job description. Okay, so if they say they need people who do more of advanced lung function, more of polysomnography, polygraphy, management of obstructive sleep apnea, think in your clinical experience, have you did this? And try to give examples. Okay, and this is something, and there are also many blogs you will find on how to write supporting information. Okay, and it should be very much straightforward. Don't do a big story in supporting information. Just keep it very clear information. And also, if you get interview, there are again many links in YouTube where you can check for if you're applying for a band 5 NHS interview questions, and then you can go through those questions, prepare yourself, and I'm more than happy to assist somebody with their interviews. So feel free to contact me. I would appreciating contacting me on LinkedIn or Instagram. So I'm more than happy to assist if anybody needs any help.
Definitely, guys. Those who need help, please contact Ms. Sumi in the LinkedIn. Are there any
Um,
specific CV format?
Um, yes, I mean, yes and no, I would say. So there is a specific UK CV format. So the CV that we use back in India is it's with photos and everything. We don't use any photos. Straightforward. What skills you have? What's your name? What's your objective? What are the um, experience, qualification? You can find this template anywhere on Google. Just try to use that. Make sure it is not very colorful. We like lots of colors. Just try to keep it as simple as you can. And again, stick to the job description. Don't use one CV for all jobs that you're applying. Go through the job description, see what they're asking for, and then formulate your CV. This is something again, as a student in an international country, can we pay up to half fees by doing part-time jobs?
Part time.
It totally depends what job you're doing. So um, don't just come here for the sake of you know doing jobs or earning money. If you're doing a course, and if you're interested in that course, try to focus on the course. And then obviously you can only do 20 hours per week as a student. And on during vacation period, you could do full time, which is 40 hours. So it depends. So there is a basic hourly wage here. So you have to check how many hours you're getting. And so you may not get into healthcare straight away. So you might have to do healthcare assistance, and random jobs. And there's nothing wrong about doing it. And you
Doing
have to take this in your mind that this, I can't do this. If you're coming to an international country, you have to be prepared to make your ends meet, okay, by doing random jobs. So I'm not sure whether you can meet. It totally depends on what job you are trying to do.
yeah.
Hmm. ACLS, BLS, not I mean, again, ACLS, BLS is more of an American concept. So there is UK resuscitation program and everything. So you will be given training for BLS, and there's no advanced. We don't do advanced cardiac life support here. So just BLS. If you are interested, you can do something called as immediate trauma life support, ITLS. Again, I am having plans to do that. So once I get to know what other requirements, I'll let you know if somebody wants to know. Um, Anybody?
I think many of the questions are repeated. Guys, please, I'll also post this video on my Instagram page so that you can also watch this sometime.
Internship program, there is no internship programs. But one thing you could do is our hospital here, they do have observer programs. So if you
Mm.
want to what a clinical physiology or respiratory physiology do, just go and approach the manager there and apply for an observership role. So what the
But
students,
is it with stipend or no stipend?
no, you're just observing. Okay.
Okay.
So the students who are doing the 11th and 12th, they want to decide what stream they want
Mm.
to go. They will write an email to the HR here saying that I want to get 1 day of observer experience in this department. And the HR will speak to that manager, and the manager will, if they're happy to have you, they can arrange some observer programs. So basically, you go to the department, see what they're doing, and you can also understand what training extra you would need. Speak to the manager. So it is more of networking as well. You can network with the manager and let them know that this is what your background is, you're interested, if there are any jobs coming up. So obviously in future, if they see your job profile, so they know what a respiratory therapy
Mm.
is, so they will be more interested to know about you. Hmm. There is no, again, no MSc clinical physiology, no course to become a respiratory physiology. Unfortunately, there you could. I mean, if somebody is interested to do masters, try something called as exercise clinical physiology. They teach a bit about. You can specialize in CPET, cardiopulmonary exercise testing. This is again something respiratory physiology would do. They will also deal with breathing tests and everything. So some of the respiratory physiology jobs are done by exercise physiologists. So they have this training there, but there is quite a shortage of respiratory physiologists in the country. So try to apply for jobs. Tell them what you are, and if they're happy, if they're interested in you, they will definitely hire you. Mm, is there anything? Again, no master's program. Internship is Suresh is asking, are internships in India taken into consideration? This is a very common question. Unfortunately, not. Internship is part of your program. Like if you're doing a BSc, it is attached to your internship. So you have to get after internship, you have to have at least 1 year, 6 months to 1 year of experience, and then try. I mean, this is better for your CV, just for your CV, because obviously they want to know whether you have experience in that field or not. Uh, what is the career pathway for respiratory physiology? Are there any promotion in back? Definitely there are. I mean, again, you have to speak with the manager. What is the chances of promotions or not? Okay, so obviously, in my personal view, my hospital has a good progression job roles. I mean, I started as a band 5, now as a band 6, taking
Mm.
on more extra roles into home mechanical ventilation. So it totally depends on that trust you're applying. And definitely make yourself, what do we say, visible. So if you're in a team, let them know these are the skills you have. For example, ABG is something we learn from BSc, right? From second year, third year.
Yeah.
And here they need a specific training for that as respiratory physiology. I told, well, I've been a few years. They just saw me doing it and they were like, well, okay, you can do it from now on. So this is something they knew I was doing. So they made me do it, made me do a specific clinic where we have to check, do their ABGs, check their oximeter results, and see whether the symptoms are controlled or not. And now I'm doing more of wards. So in mechanical ventilation, they do patients on wards. So again, this is something similar to what I've done. I'm kind of liking this now. So this was only happening because I let them know. See, this is what I'm doing. This is what a respiratory therapy would do. I would get into a discussion. Oh, I used to do this. I used to do this. So they know me now, and it is very
Okay.
important that you tell them um, it's not good that you come, do your work, go home.
Mm.
Just try to mingle with the team and share your experience. I mean, obviously, I like teaching, so I just if there are some juniors who come to the clinic, I just teach them. So yes, this is something you could do. So, and then there
Great,
are
ma'am.
chances for
Great to see.
promotion. Um, One last question is a visa process. So visa. So once you get an interview, once you clear the interview, the NHS trust will give you certificate of sponsorship, which is called COS. Okay, so you can use this COS and apply for a visa. So you need to have an agent who does the visa process. So they will do this visa process for you, and make sure you have a valid passport. The passport should be at least uh, be valid for more than 6 months. If it's less than six
Mm.
months, renew your passport. So get all these things ready before you apply for a job or while you are applying for a job. Right.
All right, ma'am.
I guess we overshoot the time today.
Yeah, yes, yes. So I hope we have addressed questions.
Yes.
I think, would you like to share the new young artist who is looking to move to the UK? What's your go on suggestion? Whether can they come to the UK or no? What it is?
So, I mean, every country has its own plus and minus. Okay, so I've written down some plus and minus here. Like I said, I personally like the place that I am living. So obviously, you have to see what city you're going
Mhm.
to. Is it too costly? Crowded? Is it polluted? Is can you afford the rent? So all this. But I'm quite lucky from that point of view, and obviously, people will have doubts about unpleasant experience such as racism, and in the media they just hype the incident.
Yeah.
So obviously, this is something we all think, oh my God, they're too.
Mm.
This is what is happening, but no. I mean, in my personal experience, I am lucky to have a team who's always supported me. Obviously, there are people who would do indirect comments, but I
Mm.
have a team who would, jump in front of me and asking them to stop. Okay,
Okay.
and and at the same time, if you have the right tone, if you tell them, I'm being offended, you have to stop right and now. There are rules in the hospital to support you. I mean, if you've been not treated well by your manager, by your colleagues, by any patient, you have people to go. So this is something which I think lagged in India when I was working.
Mm.
So I couldn't say to anybody because somewhere my head would come to know that this is what is happening. But here there's something called as confidentiality. So whatever you say, it is kind of confidential, and they will try to act on your grievances. So this is something, and work-life balance. I mean, obviously, I have a family life. Has to stress about work after I come here. So this is something I like. And obviously, when you compare with Middle East and here, you don't save here much in the UK. That's one.
Mm.
If you're coming here for looking after big bucks and everything, may not be possible. And especially if you have a family and everything, all your expenses are being
True.
utilized here. You may not be, if you have a huge debt back in India, maybe because of student loan and everything, you might, it will be, I'm not telling it's impossible. It could be a
Mm.
bit tight situation. And again, this comes in my aspect of think ahead. So you have to think, is it worth for me to go there? And on the outside, it will look, when you convert it, oh my God, yeah, the package is very good. It is one and a
Mm.
half lakh, 2 lakhs, but think about the deductions as
Yeah.
well. So if as an individual, can you afford all the life expenses that they have there? So I would say mixed feelings, but more of good feelings, I
Mm.
would say. Because like I said, it also depends on you, how flexible you are. Okay, if you are a very stubborn person, if you are quite homesick, if you think about India every time you want to go back, there's no point of coming here. Okay. So,
Yeah.
so think what you have to do. If you are spending
Mm.
huge amount doing masters, if you have to go back, don't take this step, because why are you spending this money then? I mean,
Yeah.
obviously, if you can manage that money, I don't have any problem. But yeah, totally. I feel it is totally worth it, although it was not my choice, but it came out of chance. And speaking of it, respiratory therapy is also out of choice, because it was never my choice. It was out, but still it worked out very well for me. I have a skill set that I could use, that I gained over a period of time, and I can utilize it for patient care. So I tell my manager. My manager is very supportive. She will make sure that if I have something, she will make sure, if I have some needs, such as a training need, she will try and find a certain course to make sure that I do that course and I meet
Mm.
that and my entire team is very supportive. The hospital staff is supportive. And yeah, and we have a cultural society here. I'm quite active in that as well. So I mean, we are also connected to India because of the people we are here with. So it totally depends on you whether you want to be social or not. So all these factors, the individual factors, also plays a role on how well you get on in an international country.
Yeah. Great. That's true, ma'am. Actually, thank you, ma'am. I think we have come to an end. I think we have covered so many important aspects from job opportunities to educational pathways and the processing of moving to UK as a respiratory professionals. And I hope this would help uh, young artists who are looking to move to the United Kingdom.
Mhm.
So thank you so much. Thanks for joining with us, ma'am.
Thank
Do you want to say anything, ma'am?
No, thank you so much. It was very happy. I feel very happy to connect to my fraternity. And yes, I guess I have to answer this one last question, whether we have to do MSc in respiratory therapy. Um, it totally depends, because MSc, so our concept back in India is finish all your teaching, learning first, and then do a job. It's not that. Do MSc only if you're interested in research. Okay, so there is not a very high gain if you do MSc. Okay, so obviously you will be specializing in something. You will have an additional master's degree, but you can also do a master's degree after doing at least 2 years of experience after BSc, and then you also have an experience, you also have a master's degree, so you're not a fresher in the market. So you don't, if you directly do a master's degree and you come out to do a job, you're a fresher, you will not be happy with the pay you will be getting as a master's. You're like, I did master's, how, why
Yeah.
am I getting low?
This
So
used to
think
happen with
twice.
many of the young artists. Yeah.
Yes. So yeah, this is what I would like to say. Yeah, sorry, Kishore, you were
No, no
winding.
problem.
I thought I had to answer the question.
No problem. And it's totally worth it.
Thank
So
you.
I found this session useful, and I hope our students also will find this session
Sure,
useful.
sure,
And guys, if you have any doubts, please let us know in the messages, or you can connect through LinkedIn or Instagram or wherever you want. So with that, we come to the end of the session. So I thank our guest, Sumi ma'am, Ma'am, and please convey my regards to your family
Thank
as
you.
well.
Thank you so much. I guess my son has personally come to say bye at the end. Bye, Bye.
What's his name, ma'am?
His name is Ruel. Say bye.
Ruel Sugumano.
Bye. Say thank you, Bala. Thank you. Thank you.
Thank you. Bye. Take care.
Bye, thank you. Have a nice day, Para. Okay. Okay. Thank you so much.
Thank
All
you so
right.
much, ma'am.
Let me know,
Thanks
Kishore,
for
if
your
you
time
have
as well.
a personal question. I mean, if somebody personally messages you,
Uh,
let's see if I...
Definitely, I'll also
Okay.
send you. Sure.
All right. Bye.
Yeah. Bye bye. See you.